What if you were to slowly lose your vision and not even know it until it was too late? That's exactly why a disease called glaucoma is so scary and so dangerous. I'm Dr. Robert Gunzenhauser. I'm an ophthalmologist working at the IMDs of Inland, and today I'm going to be talking about glaucoma, what it is, why patients don't notice it initially, what are some of the common risk factors for developing glaucoma, how we diagnose it, and how we treat it. Let's get started. So first, what is glaucoma? Glaucoma is a disease that damages the optic nerve. That's the structure that carries visual information from your eye to your brain. You can think about it like a cable with a million tiny little wires. When those wires or nerve fibers get damaged, we typically can't get them back. Glaucoma is also often associated with something called high intraocular pressure. That's basically the pressure inside your eye. Although some people can get glaucoma even if their pressure is technically in the normal range. It's just not normal for them. Next, let's talk about why patients don't notice glaucoma early on. One of the biggest problems with glaucoma is that it damages your peripheral vision first. That means that it will gradually and silently lead to vision loss at the edges of your vision first, and then move inward only later in more advanced stages of the disease. One of the reasons why people don't notice this early on is because your brain is especially good at filling in missing visual information. So peripheral vision loss can continue silently without being noticed. By the time central vision loss happens, significant and permanent damage of the optic nerve may have already occurred. Next, let's talk about the risk factors that increase one's chances of getting glaucoma, because some people have an increased risk of getting glaucoma over their lifetime. Those include people who have a positive family history of glaucoma, especially those with a first-degree relative who have glaucoma, people who are over the age of 40, people who identify as African American or Hispanic, people who have a history of diabetes, people who are especially nearsighted, and people who have a history of using steroid medications. However, it's important to know that virtually anybody could potentially get glaucoma. Next, let's talk about how we diagnose glaucoma. The good news is that we can often diagnose glaucoma at a very early stage with a regular comprehensive eye exam. As eye doctors or ophthalmologists, we look at a number of things regarding your eye to catch glaucoma early. We look at your eye pressure, we look at the appearance of your optic nerve, we do peripheral vision testing, and we also take scans of your optic nerve. And while we can't reverse damage from glaucoma, we can implement modern treatments to slow or even prevent further peripheral vision loss. And lastly, let's talk about treatment for glaucoma. Current standard of care therapies for glaucoma include eye drops, laser procedures, and interventional surgery in the operating room. The whole goal with treatment is to lower eye pressure and to protect the optic nerve for the long term. So if you haven't had an eye exam recently, especially if you're over 40 or have somebody in the family who's got glaucoma, or if you identify as African American or Hispanic, getting screened for glaucoma is one of the best things that you could do to protect your vision. Because with glaucoma, the vision that you lose is permanently lost, and early detection truly matters. I hope you enjoyed this video. If you did, please leave me a like, subscribe to the channel. I'll see you guys soon. Thank you so much.